Hello all, this will be a short video on Chapter 7 because the majority of this material is covered in lab. You'll be learning the names of all the bones of the body and some additional terminology. So that is your main focus with this chapter, which is basically rote memorization. There are a couple of additional pieces of information within this chapter that I will pull out and explain that serve to help you better understand how the pieces of the skeleton puzzle fit together. It's a little bit more complicated than Herman Munster led us to believe. Beginning with the axial skeleton, the skull is divided into the cranium, which houses and protects the brain and the brainstem, and the facial bones. Most skull bones are connected to each other through sutures. The mandible is connected to the skull by a synovial joint. We'll be talking about synovial joints in greater detail in Chapter 8. The skull bones of a fetus are not tightly held together, which allows the bones to slide easily on each other during childbirth. In an infant, the areas where cranial bones meet are not fully ossified, and here we see some remaining fibrous membranes. These areas are known as the fontanelles, and they will remain open to allow skull and bone growth in an infant for up to a year. The skull is connected to the vertebral column by a joint between the occipital bone of the cranium and the atlas, which is the first cervical vertebra. The vertebral column is made up of 26 movable parts, which includes 24 vertebrae, a sacrum, and a coccyx. The 24 movable vertebrae are divided up into 7 cervical in the neck, 12 thoracic in the upper and mid-back, and 5 lumbar in the low back. The sacrum consists of 5 fused bones, and the coccyx is 3 to 5 small fused bones. The vertebral column is S-shaped, exhibiting curvatures, and the sacrum is curved as well. The cervical and lumbar curves are concave posteriorly, and the thoracic and sacral curves are concave anteriorly. There are abnormal curvatures that can occur with the spine, such as scoliosis, which is a lateral curvature, kyphosis, which is a hypercurvature in the thoracic spine, and lordosis, which is a hypercurvature of the lumbar spine. The freely movable vertebrae articulate with each other at the 2 sets of articular processes, and with the exception of C1 and C2, at the intervertebral discs. There are 2 long ligaments that stabilize the vertebral column and run the length anteriorly and posteriorly. These are called the anterior and posterior longitudinal ligaments. The intervertebral discs function as shock absorbers and allow the spine to flex, extend, and laterally bend. These movements you will learn about in Chapter 8. The discs are made of an outer fibrocartilaginous ring called the annulus fibrosus and an inner nucleus pulposus, which is a gel-like material. The annulus may tear as the spine undergoes acute or chronic injury, causing a disc bulge. If the tear is large enough, the nuclear material can escape, and this is known as a herniated disc. In lab, you'll be learning the general structures of vertebrae and how to identify each of the vertebrae from each other, including the cervicals, the thoracics, lumbars, the sacrum, and the coccyx. The thoracic cage consists of the thoracic vertebrae, the ribs, and the sternum. The ribs articulate with the thoracic vertebrae directly and with the sternum indirectly through the costal cartilages. In lab, you will learn about the sternum and its parts, and the 12 pairs of ribs and the 3 different types.
The pectoral girdle refers to the bony arch formed by the clavicle and the scapula. The primary function of the pectoral girdle is to act as an attachment point for the muscles that provide arm movement at the shoulder joint. It also provides the only connection between the arm and the axial skeleton.
So like our friend with the cool voice just said, the pectoral girdle is attached to the sternum through the clavicle. And this is the only attachment that the pectoral girdle has to the axial skeleton. And this allows for great freedom of movement of the arm and the scapula. The clavicle also acts as a strut or shock absorber, bracing the arm, and it also allows the arm to clear the thoracic cage. The upper limb consists of the arm, which has the humerus, the forearm, which has the radius and the ulna, and the hand. And in the hand is the wrist, which contains the carpals, the palm, which contains the metacarpals, and the fingers, which are the phalanges. The pelvic girdle consists of two large irregularly shaped bones called coxal bones, and the coxal bone is three fused bones called ilium, ischium, and pubis. The two coxal bones articulate with the sacrum at the sacroiliac joints to form the pelvis. In the female, the pelvis is adapted for childbearing so that it is tilted forward more so than in the male. It is wider and has a greater pubic angle than the male pelvis. The femur articulates with the pelvic girdle at the coxal bone at the juncture point of the three fused bones called the acetabulum. So the lower limb consists of the thigh, which is the femur, the leg, which is the tibia and the fibula, the patella, which is part of the knee joint, and the leg articulates with the foot at the ankle, and the foot consists of 7 tarsal bones, the metatarsals, and the phalanges, which are the toes. So that concludes the Chapter 7 material for this video. Now it may seem like I went very quickly through the chapter, and I did, but that's because most of the material you're going to be seeing in the lab. So make sure you look at the lab manual, you look at the exercises, and realize that we're going to be naming all of these bones in lab. And in our next section on joints, we will be learning specific parts of some of these bones related to the shoulder and the knee. Well, that's it for this video. I'll see you next time.